This is acute phase range of motion exercises, starting with a heel slide. So active range of motion. You can do it as active assisted with a strap. And as you can see, I have my foot sliding on a slider, furniture slider. Usually if you're on the table, it'll just slide nice and easy with a sock. Knee flexion and extension, active range of motion. We do seated in a chair, extension, flexion. You can make it assisted if you need to with the slider as well. We did heel slides, supine hip adduction and abduction. You can put their foot on a slider. Some people consider this active assisted. They use the slider, although it's pretty a resisted exercise to your hip flexor more than anything in the adduction movement. If you don't have the slider, so use a little bit more of your adductors for these. You just want to have a foot sliding on something. Supine, IR, ER, again focusing on the right leg, IR, ER. Could also do this in prone. So now I'm showing you my left leg. You do this one bent. So this is IR, hip ER, IR active range of motion, ER active range of motion. As well as in the sitting position, ER, IR, ER, IR. Then we have your bent knee fallout or supine clamshell, which is basically the same as this active range of motion of the external rotators. Just going nice and slow, controlling that motion. You go all the way in throughout the range of their ER and IR. We're gonna call that a windshield wiper. Whereas a bent knee fallout, you more or less go to neutral and then out. And if you do some resistance at the knees, then we're gonna call that both together at the same time. We're gonna call this one a supine clamshell. And again, you can add resistance with a band around the knees. We're gonna add our acute phase other exercises, doing a weight shift on the Air-X. So you're just standing on the mat, on the foam, doing a weight shift. You can use a wobble board. This will be the progression. They can do it in the medial lateral position. Or in the anterior posterior position. And then last one would be your marches on the foam. Trying to get that single leg balance, so you're gonna have them do it nice and slow so that they have to do a little bit of that more prolonged single stance time than simply just marching fast. And our other one that we like to use for any patient in the acute phase is diaphragmatic breathing or belly breathing exercise. So you're gonna have one hand on your belly, one hand on your chest. As you take a deep breath in, you must feel and see that belly rise. Breathe out and it should go toward your spine. Breathe in, belly button away from your spine. Breathe out in towards your spine. The reason you have this hand on your chest is to make sure that when you're doing those belly breathings, you don't feel your chest moving as well. So your chest is stay relatively still. Just the belly up, belly down. In.